patient may be dying. Hello? Yes, Natalie. Well, then keep him alive till I get there. That's your job.
Code blue, the patient is coding.
We'll return to your feature presentation after this short commercial break.
We are a student of Miami-Dade College, and we want to inform you the information about the antibiotic.
Introducing erythromycin, the prototype of microlights. Have you ever had an allergic reaction to penicillin? Well, why not try erythromycin? It is indicated for the treatment of bacterial infections in patients who are allergic to penicillin. Erythromycin. It works by binding to the bacterial cell membrane and changing its protein function, or in other words, interfering with the protein synthesis. This action can prevent the cell from dividing or cause cell death. Depending on the sensitivity of the bacteria, the concentration of the drug.
Erythromycin can be used to treat respiratory, dermatological, urinary tract, and GI infection caused by susceptible strain of bacteria.
The side effects for erythromycin include abdominal cramping, nausea, vomiting, diarrhea, superinfections, rash, potential for hearing loss, pseudomembranous colitis, liver toxicity, dizziness, and other CNS effects. Microlights are contraindicated in patients with known allergy to any microlite. Ocular preparations are contraindicated for viral, fungal, or mycobacterial infections of the eye, which could exacerbate by loss of bacteria of the normal flora. Use with caution in patients with hepatic dysfunction because it alters the metabolism of the drug, in patients with renal disease which alters the excretion of the drug. Also used with caution in lactating women because it is secreted in the breast milk and it can cause diarrhea and superinfections in the fetus, as well as in pregnant women because of potential for the adverse effects to the fetus. Use only if the benefits clearly outweighs the risk for the fetus. Increased serum levels of digoxin can occur when digoxin is taken with macrolides, so you're going to want to monitor the digoxin levels and adjust the dose accordingly. Also, when oral anticoagulants, theophylline, carbamazepine, or corticosteroids are administered with macrolides, the effects of the drugs reportedly increase as a result of metabolic changes in the liver, so you're going to need to reduce the dose of the particular drug and monitor your patient. When cycloserine is taken with macrolides, increased serum levels can occur. As a result, you get renal toxicity. This combination should be avoided if at all possible.
Food in the stomach decreases absorption of oral macrolides. No food. Therefore, the antibiotic should be taken on empty stomach with a full glass of water. Or 1 hour before, or at least 2-3 hours after a meal.
We will now return to your feature presentation. Okay, it's recording. Okay, so testing 1, 2, 3, making sure volume's good, picture quality's good.
Go. Hi, we are a student of Miami-Dade.
Okay, keep going, keep going, keep it rolling. Keep it rolling, go.
Parate. Stop.
Just keep it going. No. Okay, stop.
Food in the stomach decreases absorption of oral macrolides. No food. Therefore, the antibiotic should be taken on empty stomach. We say 8.
Keep going.